Dzień dobry Państwu raz jeszcze. Witam po przerwie i zapraszam na kolejną część.
Welcome, ladies and gentlemen. Welcome after the break, and let's resume our conference, the 14th International Evaluating Conference. Well, before we go into the presentation, some technical info. After each presentation, as I've mentioned that many times before, you will be able to ask your questions via Q&A or by raising your hand. If you would like to show your face, then we would welcome that very much. But we have the questions that you've already sent us via our website. I don't know if you remember that, but before the break, I've encouraged you to ask a short question, to answer a short question on the cohesion policy and its role in fighting pandemic effects. And we've got the results. Let's see those. And according to you, the cohesion policy may help the most the health protection. 28% of respondents gave this answer, but it's not a surprise, I guess. Also, the labor market is the second most popular option. And the third most popular option is the entrepreneurship, followed by tourism and culture, less green economy and digitization and education. Will those be our priorities? Well, that's an interesting question, and maybe we will be able to receive an answer to this question in the presentations that we will see in a moment. And during the discussion, during this part, we will show a series of presentations that touch upon various areas and how they were affected by the pandemic and how the implementation of cohesion policy was effective. Many of the measures have already been implemented. We'll be looking into those. But firstly, I'd like to ask David Alba, who represents European Commission, to tell us about the measures implemented in monitoring and evaluation during COVID pandemic. Well, we've talked about it a lot, but we are eager to hear more. David, over to you.
Thank you very much. Thank you very much. Will you share my presentation or shall I do that?
Tam można podzielić się ekranem.
I can share it. You can see my presentation. Yes. So I think the COVID pandemic had presented a major challenge to the entire European Union for national, regional, and local communities countering the disease, and now the social economic impact. The Commission launched last April 2 packages of measures: the CRE, the Corona Response Investment Initiative, and the CRE Plus, to mobilize EU cohesion policy in the face of the crisis. While the CRE packages did not really offer additional EU financial resources, they provided the flexibility to use existing unspent resources and redirect them to where they are the most needed. It also offered flexibilities such as transferring unallocated EU funds between the funds and the categories of regions, an immediate increase in liquidity to improve the cash flow, and an option to increase the EU co-financing rate to 100% for the accounting years 2020-2021. Finally, exactly a year ago, the Commission presented the REACT EU package, which amounts around 50 billion, 47.5 billion euros exactly, to be spread over the years 2021-2022. It is very interesting, the poll you made, because it was a spot on, not exactly, because I think it understated the support provided for businesses. But if you look at the figures in SFC and operational programs, the main focus of the investments are for the health sector. to secure personal protective equipment, finance testing, support hospitals by purchasing medical equipment, and also the business sector by providing working capital for SMEs, facilitating digitalization, and setting up redesigning financial instruments. And finally, for employment ESF measures, for employment retention schemes, and supporting vulnerable groups. According to the latest figures on the volume of the resources which are mobilized, overall around 23 billion euros were reprogrammed. 7.4 billion euros reallocations went to the health actions, with a net increase of 7 billion euros. 12 billion euros of reallocation went to business support. I think this is the figure which is much higher than in the poll, with a net increase of 4.4 billion euros, and 3.8 billion euros went to directly support people, including workers and vulnerable groups. But that's not all, because the financing and the modified rules resulted also in an additional liquidity of 7.6 billion euros, and also 5.7 billion euros have been transferred between funds and the categories, and 176 programs has opted for the 100% EU co-finance rate, which actually also represents around, I think, 7 billion euros, which could be used at that particular year by the state budget. Of course, providing the financial support is one thing, and on the other hand, we also want to track the output. And tracking this COVID-19 pandemic response posed a particular challenge for cohesion policy, because the original monitoring systems were not really designed to track these exceptional flexibility measures which were recently introduced. For these reasons, we proposed new financial and output indicators, common indicators, COVID-19 indicators, to be used in the operational programs. These are not common indicators defined in the regulation. This is common indicators defined in a separate paper, so their use is much more voluntary. And I think it's very important to remember that when we look at the actual figures. Based on this, we can rely on two strands of information if we want to understand the COVID impact on cohesion policy in the years which we observe. On one hand, we have tracking the before and after changes in the financial allocations. This is quite straightforward by the financial tables in SFC, and this is the data which I have just presented to you. However, by using the new COVID-19 related indicators, we can gather more detailed and accurate information. And while we strongly encourage the use of these indicators in all of the operational programs, we also have to be aware that these alone do not paint on the whole picture because these indicators are voluntary, okay? Moreover, there are some countries who targeted very special, very specific national actions that cannot be aggregated on EU level. However, having said that, all the data is available and downloadable on the open data platform, and especially in this COVID dashboard. So if you know the open data platform, but also Google will help you with that. And then in the stories, you can find the COVID dashboard. And I encourage you to visit and to use this data as much as possible for your understanding of cohesion policy. There are three categories of these common COVID indicators which were defined, notably in the categories of the main beneficiaries, financial beneficiaries, health, SMEs, and people. And in every category, there are two subcategories which are indicators which measure financial data, such as, for example, in health, the value of, for example, protective equipment, and other, they measure a number, okay, like a direct output, like a number of ventilators. if you go to the COVID dashboard, all right, you can already see that according to the indicators, already more than 1 billion euros are being spent. These are the targets which are set in the operational programs. 1 billion euros is set as a target for purchasing personal protective equipment in healthcare. And this is followed basically by other medical equipment, medical equipment bit below the billion euros. So I think if we add the two figures up, it's already above 2 million euros. And this maybe it's not the full picture, okay? If you look at enterprise support, the same logic is being followed. There is a distinction between two types of indicators. We look at, for example, as the value of support to SMEs for working capital, and also we look on the number of enterprises you are planning, or the operational programs are planning to support.
Excuse me, could you press Control plus L, because not everyone see your presentation here.
Is it good like this?
Yes, that's better. Maybe you could close maybe some other windows. I don't know.
Is it better or not anymore?
Yeah, it's better. Yes.
Okay, all right. So if we look at the figures here, we can see that the biggest program or biggest member state providing SME grant support to working capital is Italy, all right, with 626 billion euros, and followed by Poland. But it's very important to see the number of SMEs supported, where, for example, in Italy is much higher. So it seems like that Italy provides less support by SMEs than other countries. The COVID dashboards also gives you the opportunity to drill down on the individual figures. Notably, you can see for not only the aggregates of the different indicators, but you can also see from which member states and which operational programs these figures are coming. In February, we also have for ESF programs, again, it is the same logic. We are looking at the values, and we are looking at the number of persons which are supported. So you can see that the number of participants supported are rather huge. In Italy, Bulgaria, Greece, these figures are 1,500,000. Quite a number of people are participating, or the operational programs planned to support these actions. Finally, in February 2021, we introduced a number of additional indicators to enable the following of the vaccination support, the vaccination costs, and also the vaccination infrastructure. So far, we have less figures, obviously, on this, because we need the operational programs to be adapted and adopted accordingly in order to enable us to follow these figures. The later we go in the modification, the more we will see. Obviously, again, these figures do not grasp yet the REACT-EU modifications, where again the member states are encouraged to use these indicators. However, since it's an ongoing process, we do not yet see the figures coming in. Maybe in a half a year we will have more final figures, and then we can also start to look at the implementation values of these figures, not only on the targets themselves. All over the indicators are used widely. There are more than 700 instances of use of these indicators, and we identified a number of national indicators which address COVID. But again, as I mentioned, these are not the type of information which can be aggregated by us. Also, the COVID had an impact on the evaluations. I think it's not surprising that there are very few and really no evaluations so far which address COVID per se or the COVID impact. Having said that, there are a few evaluations which mention the difficulties caused by COVID, okay? And there are also instances, also in the Commission, but also in the member states, that evaluation had to be delayed because of the COVID situation, because of the constraints the crisis presented in actually operationally implemented the evaluations themselves. We plan to address the COVID measures in our ex post, which will be kicked off soon and which will have to finish by 2025. So DG REGIO will look obviously at from every level the impact of the crisis on our funds. If you look at these evaluations which mention COVID-19 related issues, here we rely on a service paid by DG REGIO, the evaluation help desk, where all of the evaluations are from the member states are reviewed, and that's why we kind of have a little bit information. So far, the help desk has identified 55 evaluations which mention COVID-19 related issues. All were published between June 2020 and March 2021, and they were undertaken in Italy, Poland, Czechia, France, Denmark, Germany, Lithuania. There are more evaluations on the ESF interventions than on the ERDF one, but I think that's a natural trend which is not really COVID related. Also, it's clear, and this is something which comes and is mentioned in the individual evaluations themselves, that these online interviews instead of face-to-face one resulted in less fieldwork than planned. And also the crisis affected the implementation of measures in education and culture, and it led to reprogramming and reallocation of funding. This is the information which comes from the evaluations themselves, but of course we have the monitoring data which gives us a more accurate information on this matter. Also, the evaluations mentioned the need for learning lessons from the pandemic and also to build these lessons in the future programs. For example, more flexibility in program design to allow these new challenges to be addressed. Okay, thank you very much. I think I used all my time.
Tak, prawie tak. Bardzo dziękujemy.
Almost. Thank you very much, David Alba, DG REGIO. I can't see any questions to the presentation. Thank you very much indeed for this presentation. Thank you. And now we change the topic a little bit, and we will be passing on to the member state perspective and their response to the pandemic. We shall start with the Czech perspective, and we will listen about the challenges for the cohesion policy from Lukáš Maláč as Evaluation Advisory CE. Over to you and welcome.
Good afternoon, and thank you for the introduction. Can you hear me well?
Yes, yes.
Very good, thank you. I will just share my presentation. Okay, can everyone see my presentation well?
Yes.
Very good. Okay. Once again, thank you for the introduction, also for inviting us to this event. My name is Lukáš Maláč. I'm representing private company Evaluation Advisory Central Europe. We are dealing predominantly with evaluations in the public sector, and we have been commissioned by the Ministry of Regional Development of the Czech Republic to implement this evaluation, which is called analysis of ESIF measures responding to the COVID-19 coronavirus pandemic. It's a longer or bigger assignment. I will only focus on this part. So it is a work in progress, I should say. We have handed in some drafts of some of our deliverables just yesterday or the day before yesterday. So it's very much still moving target, but I will try to present what is the status quo and what we know right now. This is the objective of our evaluation. Assess the support provided by for elimination of impacts of COVID-19 pandemic by analyzing the relevance and effectiveness of support of measures supported by European funds to pandemic in order to provide inputs for future targeting. Meaning, I will get to that just in a minute, but meaning have a look at what has been supported, especially with the support of European funds, and provide some inputs regarding future targeting of this support. Then analyzing the specifics of reaction of selected member states to COVID-19 within, again, support of European funds. And last but not least, rigorously analyze the impacts and effects of ESIF-supported measures that react to COVID-19, which will be the biggest part of our assignment, but that has not started yet. Understanding of the objectives. So what does it actually mean in specifics? What are we going to do? First, we'll focus on mapping all anti-pandemic measures that have been implemented in Czech Republic. The original assignment stressed the React-EU and its delivery in the Czech Republic. However, this issue has been already decided in the Czech Republic, at least for the first tranche. The Integrated Regional Operational Program has been amended in January in order to draw the allocation of React-EU in the Czech Republic. Therefore, in this first part, we analyze, or we focus more generally on what kind of anti-pandemic measures have been implemented in the Czech Republic. And we analyze them with regard to the targeting. Has the targeting of the measures been done well? Are there any white spots, what we call white spots, so areas, sectors, target groups, and so on, which were not sufficiently covered, although they have been severely affected by the pandemic? Then, has the potential of European funds been, especially in context with CRI plus legislations, has it been sufficiently taken advantage of in the Czech Republic with regards to the pandemic? And third, as I mentioned, in the future, in similar context, what should be done? What should be done better, maybe? In order to do that, that's the second point here. In order to do that, we also had a look outside. How did other member states react? How did they specifically take advantage of European funds in order to combat the pandemic and the effects, the negative impacts of the pandemic? And the third one, third objective, as I mentioned, is the biggest one. We need to have a look how exactly did the selected anti-pandemic measures help to combat negative impacts. That's our framework. These are the tasks that we need to fulfill. So first, we map, study, analyze all COVID programs, COVID-related programs. But then we create a typology of economic sectors and economic sectors, areas, and so on the basis of how severely they were impacted by the pandemic. We approach this on the second NACE level. I will show bits of that in just a moment. Then we overlap the results of the first 2 points. So and have a look whether the programs or the support that has been implemented by the Czech government does actually overlap with the most affected sectors of economy. We are aggregating some good practice. I talked about that. And last but not least, this last task is implement counterfactual design, supported versus non-supported companies, applying probability score matching and some differences approach in order to measure as rigorously as possible the effects of the pandemic, especially when it comes to survival rate of businesses and sustaining of employment in FTEs. So those are the tasks, and our current status quo is the following. As I said, this is a work in progress. I can only show some partial results that we have available now. First deliverables we started somewhere in January or maybe just before Christmas, and first deliverables are due in June. Those are especially objectives 1 and 2 of those that I presented earlier. So mapping all the support in Czech Republic and aggregating good practice from abroad. Key milestone for us then is the point when economic data of enterprises for 2020 is made available, which we expect sometime in maybe July, hopefully July this year, and then we will use that for the counterfactual analysis, which will be done in the first results we will have in September, and the final report should be ended in January 22. So, and now what we know by now, what we have already done, and what kind of results we see. So the first task that I mentioned in the overview of tasks that we are interested with is to map, study, and analyze all the programs that have been supported in the Czech Republic related to pandemic. So for that purpose, we have created some kind of analysis metrics which provide us and the client, the ministry, with structured information on programs in force since March 2020, with the purpose to combat the pandemic itself or the effects of restrictive measures of the pandemic. We have gathered all possible information and data into these metrics, especially with regard to targeting of the programs on the basis of NACE or other criteria, regional scope, financial scope, type of support, which is very important for us. Was it a direct support, meaning some kind of grant? Was it a financial instrument? What kind of financial instrument, and so on. Then, of course, we also gathered the information on European funds support to these specific programs, time frame, target groups, and so on and so on. I will just show a glimpse of how this all looks like, and then I will have a little bit more of analysis on the next slide. So this is a lot of numbers and letters, and it's all in Czech. I'm sorry for that, but this is basically our analysis metrics. So you can see there are as many as 50 programs, if I'm not mistaken, that have been supported by well, implemented in order to combat with the effects of pandemic. And if you look, this is the column where it says what is the support of European funds. I'm sorry, to these programs. So as you can see, out of this maybe 50 plus programs, there are 7, if I'm not mistaken, that are directly supported by the European funds. These are the allocations. This is in Czech crowns, but I will have a little more data in the next slide. So this is the kind of first step that we did gather all the information on one spot, and then carry on with analysis. What we know, what we learned from this mapping or analyzing of all these programs. Overall financial scope of support to anti-pandemic measures in Czech Republic is over 3.5 billion euro direct support, of which almost half of it is spent on programs that are supposed to sustain employment. About 25 million euro has been spent on or allocated to programs providing loans, and the biggest allocation, as much as 6.5 or 7 billion euro, has been allocated to guarantee schemes. As you have seen, there are many programs. There are as many as 50 programs, as I said. But key are the keystones of combating the pandemic in Czech Republic are two programs or two types of programs. First of all, it's a guarantee program for entrepreneurs, which provides or makes available, provides the access to operational capital. So this is about operational costs of enterprises. This program, it's called COVID-3. Maybe I can look back here. It's here. It's this COVID-3 program. It has a capacity of about 6 billion euro and can guarantee as much as 90% of the credit volume. But the credits are not provided by this program. It's only guarantees, and the credits are provided by commercial banks. There is no co-financing of European funds on this program. There was a predecessor of this program called COVID-2, which was also a guarantee type of program, which had much lower capacity, about 750 million euros. And it was opened in two stages in April. First, with a very small volume, about 60 million euros, which was withdrawn within 3 hours, if I'm not mistaken. And then the allocation of the capacity was increased to about 750 million euros, which was also withdrawn within a matter of days. The co-financing of European funds on this program was about 150 million euros. So this is the first keystone, let's say, of Czech response, the guarantee program, and the second is what's called antivirus programs. That's the name, but basically it's a support to maintaining employment. It's some kind of ad hoc variant of these Kurzarbeit schemes, which is known from many other member states, European member states. It basically covers expenses on salaries in the case of that the employees cannot work due to a drop in demand or supply of inputs at the enterprises due to restrictions of economic activities or due to current quarantine measures. So this is the second biggest program. Additionally, also social security payments can be temporarily waived in case small business is in troubles. Until today, about 1.5 billion euro has been paid from these antivirus programs, and the share of support from European funds is about 10% of this volume, which is actually the most significant target of European funds to combat COVID pandemic in the Czech Republic. Other targets of European funds expect for this antivirus program There has been some investment grants, dedicated COVID-dedicated calls for proposals has been presented in the field of technologies, in implementation of new technologies, innovation, vouchers, and so on. The volume of this program is about 23 million euro. Then there is a large what we call outplacement program, which is basically a continuation of support to active labor market policies in a COVID context. So it's a similar support, similar measures to those that were implemented already before the pandemic, but the volume or the capacity of the program has been increased. It aims at provision of services to increase employability of persons who are laid off or are at risk of losing their job. Total allocation is about 140 million euro, and co-financing of European funds on this very program is about 111 million euro. And then there is one more small program in OP fisheries ad hoc correlated to COVID restrictions. As you can see from what I've been presenting in the Czech Republic, there was some lack of systematic support in direct payments to at-risk businesses. There were only kind of fragmented ad hoc programs implemented supporting businesses in tourism, like travel agencies, hotel spas, gastro businesses, and so on. Supporting rents in retail and services, culture, sports, and so on, no more than a few hundred million euros. This approach was criticized, there was some criticism in this regard, because the support was very fragmented and with different conditions, lacking cooperation between sectors. So first in 2021, two more kind of systematized programs of direct support were introduced, which, however, do not target the most vulnerable sectors. So basically, the eligibility is done on the basis of a drop in turnovers. Total value of these new programs of direct support is about 450 million euro, but there is no support or no support of the European funds. Very briefly to REACT EU, Czech allocation of REACT is about 830 million euro, and only ERDF has been used to distribute this allocation. It has been divided into three investment targets, let's say. So about 70% of this allocation will go to health infrastructure. About 18.5% will go to emergency services, and the remaining approximately 10%, not even 10%, will go to infrastructure for social services. So no ESF or FEAD has been used in the Czech Republic. So these are some data regarding a mapping of all the programs in the Czech Republic, and some analysis of what has been supported, what kind of strategy has been approved. I will try to speed up now, because I see I'm closing to the time limit. Typology of COVID impact. This is a methodology. We use two indicators on which we decide which sectors of economy have been affected the most and which have not been affected at all, or even grew in the pandemic, and that's trends of profits and turnover or sales. So far, we only have data for this turnover or sales. The remaining we hopefully will get soon enough. So, if we have a look at the typology or the classification of economic sectors, when it comes to impact of COVID, we see very strong negative impact here, which is basically tourism, culture, and services, personal services like hairdressers and so on. Moderate negative impacts in retail, in sales of vehicles and so on, but also in construction or in engineering services. And then these are not too affected businesses. And on the other side of this spectrum, we have sectors which have been actually positively impacted by the COVID. And I believe anyone could guess which these sectors are. So retail, not in stores, basically internet e-shops, retail via internet, and also courier services. So we will still work further on this typology, but as I said, we tried to put these two on top of each other, and we see that there has been a large support to tourism or culture and so on. But for example, this sector of public construction or engineering or office support services has not been addressed at all or almost at all in our response. And this is my last slide, I believe. As I said, we have been also mapping the approach of other member states. We talked to some of your colleagues also in Poland, and they provided us with really valuable information here. I have just shown some data here on this slide, but basically what we can say is generally, and we've seen that in the presentation of Mr. Alba. So generally within CRI in EU, there has been a massive reallocations, especially in favor of healthcare services with a 7 billion net increase, and overall this sector or this area of support has been increased by maybe 70-75% overall. Then, of course, allocations to business support, to support vulnerable employees. We've seen the numbers in the previous presentation. As we can see, healthcare is a very usual target of reallocations. Also, in countries where we did research, support to purchase of personal protective equipment, medical devices like ventilators and so on, emergency services. But also support directly to medical staff has been a very usual target of allocations. However, this was not applied in the Czech Republic at all. In business support, many countries have cited their good practice, provision of operational capital to businesses, usually by the means of loans. This was also the case in the Czech Republic. However, we used rather guarantees, and the co-financing of European funds on this was rather low. Other good practices that we received in our research were, for example, support to education institutions in implementation of distant education, personal protective equipment in social services, directed support to creative industries, including export support, or investment support aimed at compensating private or drop in private investments, so stimulate growth in construction sectors, avoid layoffs, and so on. So these were the good practices. As I said, we were also supposed to identify some blind spots or white blind spots, spots that were affected by the pandemic or by the restrictions, but not addressed sufficiently by Czech COVID measures. These are I already spoke about some of those directed schemes and supports to regions that are most affected in the crisis. So this targeting approach is not sufficient, according to our experts. Supporting availability of basic services for citizens, activities aimed at groups at risk of social exclusion. So meaning that crisis affects disproportionately vulnerable groups, for example, single mothers with small children, people who are heavily indebted, youth joining the labor market, and so on. But so far, no direct support has been targeted to those groups, and also support to medical staff. So these are some of the blind spots in Czech approach to combating the pandemic. So that's all for me. Thank you for your attention. Sorry for being a little over my allocated time.
Wszystko w porządku. Bardzo dziękujemy. Lukáš, Maláč, Evaluation Advisory.
Thank you so much. We'd like to thank the Evaluation Europe, Central Europe, for this presentation. And before we move to our next guest, I have a message for you, because our users are asking for the possibility to switch languages. Of course, this is possible, and this button is in the upper part of your screen. You can actually use that button. So this is a technical info. Thank you so much for this presentation. And now let's move to our next guest, because we are actually observing the experiences of the Visegrad Group countries. But now we will switch into Poland, and we will stay with the latest research and how the pandemic affected the latest measures based on the latest analysis. And this will be presented by Maciej Bukowski, who represents the University of Warsaw and WiseEuropa, the research institution. Good afternoon, ladies and gentlemen. Let me share my screen with you. So this is my presentation, and I understand that I will be speaking Polish. Yes, of course. Well, my presentation is in English, but I will be speaking in Polish since I was requested to do that. So for the Polish Agency for the Development of the Entrepreneurship, a long-term effect of operational programs, innovative growth and Eastern Poland, smart growth and Eastern Poland. And we focus on the economic growth, unemployment, and so on. And in particular, recently we've been asked to focus on very specific measures that the agency undertook under the anti-crisis shield that was implemented in 2020. And well, we used our VESPA model, and this model has been modified by us to a significant degree, because those measures, COVID-related measures, were intervention type measures, and they were basing on different conditions.
O specyfice, można powiedzieć, kwartalnej.
And so the quarterly specific, less cyclic policy and more cyclic policy, less policy like before. So we actually used the model that was used by us. So this is the multi-sectoral model. This is DSGE model, like so the governmental sector, R&D sector is included there. So we reduced, modified this model, but we also applied it for quarterly measures. And our goal was to understand how the direct support provided to companies during the third and fourth quarter of 2020 helped to prevent economic effects of the pandemic. We focused on GDP and efficiency. So professional activity, employment were of lesser importance. And more important was the preventing unemployment, because on the short term, this kind of occurrence may happen.
To pass on to the topic, to show you what this study was about, we focused on two measures of PARP, Polish Agency for Enterprise Development. Here you can see the numbers of the measures. One was implemented in Western Poland and Mazowieckie region, and the other in Eastern Poland. As you can see, the scales were different. In total, it was almost 1 billion zloty, 900 million spent within a few months. Most of this was focused in the Western Poland and Mazowieckie region, and the smaller part in Eastern Poland. The entire measure corresponded to the 400% of the Polish GDP, so not so much, but it was very precisely targeted at helping the businesses that were strongly affected by the pandemic, that lost a big part of their revenues due to limiting their business activity. This measure was potentially very efficient because it prevented bankruptcies of such companies, and consequently it prevented unemployment. About the statistics, the average support provided by PARP under these two measures was very similar. It was around 200,000 zloty, around 50,000 euros per one company, and the period was 3 to 6 months. And the support provided in the third quarter was bigger, especially in Western Poland, than the support provided in the fourth quarter, which also results from the severity of the impact of recession in this period. This was diversified. As you can see, there were two categories of support: the companies that received smaller support and those that received bigger support. The biggest one was over 400,000 zloty, and the smallest support around 10,000 zloty. So the range was quite extensive here, that depended on the size of the company and the losses of the companies. We analyzed the economic impact of the support together with the entire program of the anti-crisis shield implemented by PFR. about the entire PFR, the context was important because macroeconomically speaking, the entire anti-crisis shield over 70 billion zloty from the beginning of pandemic to now was a very big financial injection for the sector of enterprises. It affected the entire sector, and it was the context in which the PARP worked. It is different when 1 billion is spent in the context of 70 billion spent in total, and it's different when you spend the billion without the 70 billion. This affects the whole context. Also, for example, deflation. So in the charts, we will often be comparing the whole intervention, and we'll be showing the contribution of the PARP. As regards the measures implemented by PARP, direct support was provided to approximately 40,000 of jobs. 40,000 of jobs were supported. There was also indirect support, reaching 35,000 jobs. So we estimate that in total 76,000 jobs were supported. The company that gets state support, mitigating the economic impact of the pandemic, regulates its commitments. So if a business partner doesn't receive the support, the level resulting from the contracts is maintained, and the jobs are protected not just at the beneficiary but also outside. The average direct support was around 20,000 zloty, comparable to PFR, were comparable to PFR. And a similar scale of support also applied to indirect support, 12,000 per one job, which is not a lot. And not surprisingly, the effectiveness regarding the protection against unemployment was really significant. It is more visible in the overall support of PFR. The gray line, this is the unemployment if the support came only from the Polish Agency from Enterprise Development. And then we see the darker line, which stands for the unemployment rate that would exist if there was no anti-crisis shield. And the red line is the predicted unemployment after the implementation of the anti-crisis shield. And when I checked the statistics yesterday, the unemployment was around 6% in the first quarter, which shows you the efficiency of this type of interventions, efficiency protecting jobs. It's 1/60th or 1/70th of the entire intervention. So the contribution of PARP is limited. Around 7,000 people did not become unemployed because of this program. And in comparison to almost 500,000 as a result of the entire program. It is similar in the case of production protection. Again, the intervention of PARP and PFR change as regards the scale, but speaking economically, they have a similar impact on the economy, and the impact is clearly positive. We estimate that PARP increased the GDP like that if in comparison to the situation where there would be no intervention, 0.07%, mainly because it protected businesses from bankruptcy and allowed the economy to spring back faster. And the red line here is the expected path of economic growth compared to the economic growth, expected economic growth without the pandemic. So we are back to the previous level towards the end of 2022, whereas without a series of interventions, we would spring back a year or 18 months later, and the loss in between is much smaller. So this is the main thing, not when the economy is back to the previous trend, but what is the loss directly during the pandemic and right after the pandemic. So let's say now, generally speaking, considering the entire PFR intervention, we estimate that the gain, the net is around 130 billion zloty. The loss would be that much bigger without the intervention. And intervention connected with the activity of Polish Agency of Enterprise Development, we estimated as 2.1 billion zloty. The net gain is the difference between the gross gain and the expenditure, that is 900 million. So clearly it is positive, the net, and the gross is 3 times bigger than the spendings, not in 1 year, but between 2020 and 2024, which results from a somewhat smaller recession because of the intervention, and also the companies survived. The people were not fired. They can restart production again and the investment process. I didn't show this on the chart, but we see that the investments spring back sooner to the level of investment than would otherwise be possible without the shield. So we could say from the side of economic growth, this is clearly positive. We assess the shield positively. To summarize, apart from the positive impact on the economic growth, GDP growth, and smaller unemployment, we also have positive impact on public finance because we have the net gain of 2 billion zloty, and the program is paying itself off. It costs 900 million zloty, and within the 3 or 4 years it brings over 1 billion zloty and 1.2 billion additional revenue in comparison to what would have happened if a program like that had not been implemented. And it's definitely a gain for public finance. But there is also a loss. We estimate the loss the loss is visible in productivity because in a sense, this is in a way subsidizing hidden unemployment during the pandemic and subsidizing investments that would have happened, replacing investments that would have happened maintaining jobs in a situation of smaller investment during the peak of the pandemic in 2020 and also to some extent 2021. This effect would be almost 2 times smaller, but PARP had to reallocate the money that earlier would be used for innovation support. Now this is being spent on maintaining jobs. For this reason, the cost that I mentioned is the drop in productivity maintained for 2 or 3 years, but it's unavoidable. But the GDP growth is soon back to the previous level. That's all from me. Thank you. Thank you. Thank you very much for this presentation. I cannot see any questions from our audience. So we shall now pass on to the last presentation in this part of the conference. This presentation will be given by 2 presenters. And later, we will look at the impact of the pandemic at this important area important along with health, namely education. And this difficult topic, will be presented by a duo, Małgorzata Zub and Paweł Peszko. Over to you. I guess Paweł will begin. Over to you. Over to you. Good afternoon, ladies and gentlemen. I understand you can hear me and you can see the presentation. Thank you for this confirmation, and thank you for giving us the opportunity to talk about education. We will not be talking about higher education or lifelong learning. We want to talk about another different topic, namely how cohesion policy helped and can help the education system in the face of challenges brought by the pandemic, especially tele-learning. We will be basing on 10 reports, approximately 10 reports about tele-education. Some of those are ours, and some of them we are just quoting. We are talking about tele-education. So tele-education was introduced in Poland in all schools on the 25th of March 2020, and it was like that until the end of the school year, and then it was reintroduced in October 20, and well, we still have had it until now. The exemption were the first 3 grades of the primary school, where it was slightly different. How tele-education looked will be explained by my co-speaker. Briefly speaking, because actually we could talk about this for hours on end, I will focus on the methods and tools used in tele-education, and more clearly speaking on how they differed, how the methods differed in comparison to education before there, and how this changed in the course of tele-education. Apart the obvious difference, namely education using phones and computers, the methods changed. Well, actually not so much. They didn't change so much. Was tele-education more interactive? Depends how you interpret interactive. It was interactive because there were more digital interactive tools like quizzes or tests, the computer human interaction. There was a bigger use of multimedia, of animations, of images, of videos, mainly by students. For example, as homework, while during tele-lessons, if there were live lessons on the platforms, for example, Teams or Zoom, the forms, the lectures were used even more than before, were even more frequent than before. The lecture as a lesson is predominant in Polish education, but there was less interaction between the students. There was less group work or pair work. There were fewer presentations by the student. And how this changed in the period of tele